Good evening. Thanks for joining us here at 11. I'm Denise Valdez. As our country continues fighting the rise in coronavirus cases, the flu poses another risk to people and to our healthcare system. Here in the Valley, flu season has made an impact, usually pretty early in years past, but take a look at this. This time, actually last year, the health district had already reported 3 flu deaths and more than 100 patients had been hospitalized because of the flu. But this year, a lot different. All the way through the start of November, there have been no hospitalizations and no deaths. That's due in part to more people wearing masks, sanitizing their hands. 8 News Now reporter Madison Kimbrough is live tonight with more on how this flu season could be different in light of the coronavirus. Madison?
Yes, that's right. So we currently are in flu season, but with COVID-19 taking center stage, that could mean a variety of different things for you when you're trying to keep safe. The symptoms of the flu and the symptoms of COVID-19 overlap more than they are distinct. The only 2 main differences there seem to be with contracting COVID is that many people seem to lose their sense of taste and smell, also the rate at which one feels symptoms.
COVID typically takes 3 to 7 days before you start feeling symptoms. Flu, you'll feel the symptoms a lot quicker, typically.
They are both respiratory viruses, and for months now, the CDC has been telling us that the best way to combat the COVID-19 virus is to wear a mask, wash your hands for 20 seconds, keep your distance from others, and avoid physical contact. Those tips are crucial for keeping us safe from the flu as well.
The good thing is that the way that you avoid one is the way you avoid both.
And if you wonder if masks and other precautions work, well, they're likely the reason why we're seeing better numbers this year when it comes to the flu. Because
people have been utilizing their COVID precautions, we are seeing far less flu than we saw in 2019-2020.
As of October 31st, 2020, no one had died or even was hospitalized with the flu in Clark County. Now compare that to the same time last year, and there were 102 people hospitalized and 3 deaths. So why are COVID-19 cases soaring and not the flu? There's no concrete answer, but one possible reason is the flu vaccine. Every year people get their flu shot, but of course, as of now, there's no vaccine for coronavirus. So could getting the flu vaccine help fight COVID-19? It's still unknown, but the chances of it helping are greater than being treated with nothing. Now, as for the flu shot, the doctor did tell me that 1 in 6 Nevadans do get it, but that is far behind the rest of the country, Denise.
So, Madison, you pointed out in your story that you can get either virus the same way. Is it possible to get COVID and the flu at the same time?
Yeah, so you could potentially get it at the same time, but that's why it's so important to get the vaccine to help.
All right, Madison Kimbrough reporting live tonight. Appreciate it.